We're live.
Well, let me tell you, Facebook family, you must know that we really love, with a capital L, capital O, capital V, capital E, coming to you every Monday, because we've had a multiplicity of technical problems here. I mean, it was a horrendous morning coming on here this morning, but we weathered through it, through a lot of helpers. And so we are here. And as always, if anyone's new, this is Pop Barnes Health and Community Tip for the weekend. Yes, we come on weekly. Why do we come on? We come on because the Bible says, my people perish for lack of knowledge. And so we want to give you enough health-related information that you can choose to live a healthy lifestyle, or if necessary, make competent and wise healthcare decisions. And then community tips, want to keep you online with what's going on in the community. And I always have here with me, I am so happy to have here my community partners, and that's New Horizons with Andrea Winston, who was my boss, the best boss I had in the world, New Horizons Organization Behavioral Health, and Trail Life Healthcare. Two organizations that really contribute to the community for you, and that's why I partner with them. And so I'm going to, first of all, before we do anything at all, I want to do something here. Yesterday, everybody knows her as the lady with the glasses. It was her birthday. And so I want to sing happy birthday to Susan, the lady with the glasses. 1, 2, 3. Happy birthday to you. Happy birthday to you. Happy birthday, dear Susan. Happy birthday to you.
Yeah.
Thank you. Thank you.
Happy birthday.
Thank you. That was very sweet. Thank you.
That's the lady with the glasses. And now, so I'm going to pass the baton to Miss Andrea Winston, the best boss I ever had back in the day. Really good boss. And she is the CEO of New Horizons Behavioral Health. And then she will pass the baton to, I guess, to Susan. And Susan will pass it to Dr. Pitts. And then we will introduce our guest. Andrea?
Good morning, everyone. Thank you so much, Pops. Yes, we had a myriad of problems this morning. You know, when you're trying to do good, the devil wants to come for you.
Amen.
But that's okay, because we know who we serve. So we're on, and we've got some excellent information this morning. But, you know, we had Pops made us do regular PT in the rain this morning. But we're gonna have to take penance for these technical difficulties this morning, because I guess we weren't as prepared as we should be. So I know, ladies, that means we're going to have to do some extra maneuvers later on, maybe some jumping jacks or whatever. But I'm glad that we're here. We've got some wonderful information for the community. Please excuse my poodle for barking. He thinks he's a German Shepherd at the door, but glad to see everyone. And from there, I pass it on to the birthday girl, Miss Susan Gallagher.
Oh, thank you. So glad to be here. Can't believe that this is the last Monday of January 2021. I mean, time is just flying by. And each week we bring such important information, either a health tip or a community tip to members of the community. So we hope you've been enjoying this. It's been since August 2020 that we've been running these shows. So we've got a wealth of archived information out there, and hope that you've been finding this information useful in your life, or maybe the life of a friend you can help out. And now, Dr. Nikita Pitts.
Can't leave Dr. Pitts out, boy. Dr. Pitts is on it. Dr. Pitts is on. In fact, during the run, Dr. Pitts was so far ahead of everybody, it was almost leaving us having a heart attack. She was running so fast.
I know, and Dr. Pitts looks so cute this morning with the hair done.
Thank you. I'm in a different setting. I'm not at home with my parents right now, which is a good thing. They're being cared for. So Yeah, something different. So, but good morning, everyone. Hope you can hear me okay.
We can.
Yes, ma'am.
Okay. Well, I represent Tree of Life, sitting in for Pastor and Dr. Lowell Clyott. We're a faith-based organization helping those who are not insured or uninsured. We're located at 1968 North Avenue in Columbus. We're right across from the Columbus Research Institute and really the parking lot of Piedmont Columbus Regional Hospital. We're our phone number 706-225-0355. Thank
And
you.
Dr. Pitts, thank you so much. Another organization like New Horizons, and you heard Dr. Pitts say, taking care of the underinsured or no insured. New Horizons, and I can attest to this, by the way, because I was an employee there. They never turned anyone away. It just warms your heart, these two organizations that do so much. And now our guest will be, and Susan, before I get off of it, sometime during the show, would you show your Michelangelo? So we talked about the programs so that people can see how consistent we are in bringing health and community information to them. But we have a very long-standing friend of mine, Miss Lois Williams, who has been really aligned with sickle cell disease. Now, it's surprising to me how many people who don't know anything about sickle cell. And Dr. Pitts, along with Lois Williams, and along with a lot of other individuals, Pastor Reverend Dr. Lowell Clyott, have really been a blessing for people with sickle cell, for everyone who doesn't have any health care. But you can't go any other place to get the information and the help than Tree of Life Healthcare. And now, Lois, I see you right there, back there. If you can just introduce yourself, say a little bit about yourself, and then we'll get started on the presentation.
Yes, well, good morning, everyone. My name is Lois Williams, and I'm a registered nurse. Been retired a long time, but I've been on the journey with the Sickle Cell Association for the past 25 years. So we've been around that long. Started out as just an ad hoc community group, and now we are 501c3 incorporated, and we're also located within the Tree of Life Healthcare, as Dr. Pitts noted, at 1968 North Avenue. We occupy a group of offices within that building, and we also, for the insured and non-insured, uninsured sickle cell clients in the Columbus community. But we try to reach out to the 16 counties that is within the West Central Health District.
And Susan, the lady with the glasses, I'm looking at my cousin who's in Philadelphia, Pennsylvania, Moya Lindsay. She says, good morning, Cousin Jerry and ladies, and happy birthday to the lady with the glasses. Isn't that nice? Isn't that nice? That is really nice. And Andrea, you weren't here, but we sang happy birthday to you when you were there. And the only one, and Dr. Pitts, Susan, and Cheryl were all off key. I was the only one who was on key, so I want you to know that.
I believe that. And yes, I went back and saw the show. You know, when you have these birthdays around the holiday, sometimes they can be overshadowed. So I really appreciate that. Thank you all so much.
And Pops, I'm going to be looking for my song. Pops, I'm going to be looking for my song in June.
I'm going to do that. Listen, Andrea, would you give the location of New Horizons, please, and contact information?
Sure. Our headquarters is in the Health and Human Services building here in Columbus, where we're at 2100 Comer Avenue. And also we have several other facilities and sites, but if you need to access services and you're in Columbus, that's where you would start.
All righty. All right, Susan, I think you're going to be doing the presentation, or is Lois going to be doing the presentation, whoever? Let's get started with this good information.
We're going to do it together.
Right.
And this is really good on sickle cell. And I'm so thankful that the Sickle Cell Association is here. And Dr. Pitts, you mentioned something that someone called me on that I would like for you to comment. You made the comment, and rightfully so, by the way, because I hear it, that a lot of times when individuals are in crisis and they go to the emergency room and they tell the physician what works for them.
This is the
I
first
think
one.
that, and this is not, I don't want to generalize, but I think that a lot of them don't realize that they need to listen to what, some of them, to what the patient says, because I've had 2 people call me to tell me that you were right on the money. And so when we do get to the part about pain and symptoms, if you would jump in that comment, I
She's
appreciate
not
it.
on
That
the
was a gem.
show, though. You're not gonna
Okay.
see her or anything.
Can we get started? We can.
Okay, well, we're ready.
We're all
We're ready.
set then.
Okay,
Yeah.
all right. Okay, today we're going to be discussing sickle cell disease, to inform you of what it is, the effect, how it is affected, how these patients are affected with this disease, and to let you know a little bit about the Association for Sickle Cell here in Columbus. The mission of our organization is to promote awareness in the community and educate the community. That includes all facets of our community, not only the sickle cell families, but also our medical community as well. And we want to educate everyone what this disease is all about. And our goal is to make sure that sickle cell patients in Columbus have the optimal or the best quality of life that they can have in suffering from this disease. What is sickle cell disease? It's an inherited blood disorder that affects our red blood cells. You know, normally they're round in shape, but when in this disease, there's a substance in the red blood cells called hemoglobin. That's what carries the oxygen inside the cell. And also these red blood cells carry all of the nutrients in the blood to the cells as well. But because of the inherited disease, a gene disorder, sometimes the patient would have a sickling of these cells due to a number of causes. When they sickle, they become sticky and they don't pass through the blood vessels as well. And also the oxygen and nutrients are reduced. Therefore, it causes a lot of pain to these people, and it also affects all the systems and organs in the body. And they have also a better chance of having a stroke or any kind of skin conditions, kidney, liver disease, and damage to them, because these red blood cells cannot pass through the blood vessels as they should. So a lot of damage can come from that. They have a lot of pain episodes. As I mentioned earlier, they could have strokes. And even as a child, sometimes a silent stroke can occur and you won't even know it, but it affects their development. The patients may have a lot of infections. They're in and out of the hospital in what we call crises, and they may have a respiratory infection or that send them into a crisis, and they show up in the emergency rooms. Over time, they can have bone damage. A lot of them may have to have hip surgery because of the bone deterioration, and lungs, the spleen, the liver, and all of that. Sometimes they have to have gallbladders taken out, the spleens taken out. So it is very devastating to the body. We have one patient now who's had eye damage and can no longer drive because their eyesight has been quite affected. So what's the signs? The signs of sickle cell disease, especially in crisis. They have fever, chest pain, shortness of breath. The abdomen swells quite tightly and they're very uncomfortable, can't breathe well. You may notice in that patient that eyes may look yellow and the nails, and that's what we call jaundice. That's a sign that you can see and observe right away and know that there's something wrong. They may have headaches. That's not always common, and a lot of these symptoms are not always common in every patient and may not have every one of these symptoms. And the pain that can't stop, that's a big issue, because that's the first thing they want to tell you, that they're in the emergency room because they're hurting. And our people need to understand that their plight with this pain, because they may not always look like they're in pain, but they are, because they suffer with it all the time.
And Dr. Pitts, if I can have you chime in on that, because I forget what program we were even doing, but you mentioned that and I've had two people who were thankful. And I called them recently and told them that we were going to have this program, but they wanted to thank you personally for making that comment. So would you talk about that from the standpoint of a physician? Would you talk about the pain? I've been a nurse at the bedside, and the pain is horrendous.
Right. Well, first of all, again, with sickle cell, think about it, it affects about 100,000 people in the United States, and with the majority being those of African descent. And the pathogenesis of the pain, it usually is coming from due to infections, severe pain episodes. And with that, we're talking all major systems are affected. And so, it's not just the problems with the red blood cells, not flowing as it should, but things like acute chest syndrome. It's similar to, let's say, pneumonia, but when it occurs, it can be really suddenly. And so already the pulmonary system, what we call hepatobiliary system with your liver and your spleen, when these cells, again, they're sickle shape. So they're like the shape, the shape of a crescent, like a crescent moon. When this happens, it's blocking the normal blood flow to the various vessels, especially the really smaller vessels, like what we call the capillaries. And so when this happens, blood is not able to flow properly. And let's say within the spleen, for example, the spleen has the function of filtering out blood, and it removes, let's say, damaged red blood cells from our system. But when the cell is sickled, it's blocking the vessels leading from the spleen to the other parts of the body. So think of it as just this roadblock in the spleen. So what's happening? The spleen itself is getting larger, and yet you have what we call sequestration. So all of these red blood cells are accumulating within the spleen. The spleen gets larger, and it's filled with these sickled cells. And so your body is not able to correctly filter out these damaged red blood cells as it should, and it causes painful swelling within your abdominal cavity. So again, we're moving from the pulmonary system, and it's going, again, it's affecting all organs. So not just the pulmonary respiratory system, but now you have your biliary system with your liver, and with your GI tract that's affected. So that causes pain as well. Also, in that, then, what we call multi-system organ failure. It's a cascade of events, and the pain is so excruciating. So when the normal blood flow is blocked, what we call avascular necrosis within your bones, your hips especially, and other joints, it's really painful. And not only that, what we call as well priapism, which affects young men. Priapism is in a painful erection that can last for hours, long hours, up to 4 hours. And again, this just has to do with how the blood is flowing to different parts of our organs. And it's certainly not, it's very serious. And the difference in, let's say a normal erection and priapism, again, is due to the length of time that you have this. And it can lead to further problems later on in life that can lead to, let's say, erectile dysfunction in a grown man. So when you have all of these systems affected, going to the emergency room for some of our patients, that's their only option, is costly, and there's no continuity of care, because usually you're seeing different physicians when you're going there. And there is a definite need for pain management, and it comes in different forms. Okay, we usually like to be conservative at first, but for many of these patients, they need help, let's say, within like the first 30 minutes when they get there. And it is legitimate. Their concerns are valid, but when you have repeated occurrences like that. Some, and unfortunately, it happens. Those in the medical community sometimes feel like these patients are
Right.
only seeking treatments, let's say the opioid treatments for this type
Right.
pain, and it helps. But yet, when you don't have a background, or at least nothing to show, let's say, a record of a person coming who to kind of substantiate the need, then some of the medical professionals, they tend to not be as careful with some of
Right.
these patients and brush them off.
Mm.
And I've seen this happen, unfortunately. So to your point about your the people who you spoke with regarding mentioning that to you,
Yeah.
it is true, it happens, and
Yes.
hopefully with more funding, patients can get the services that they
Right.
need and promote the continuity of care. But again, the
And-
pain is serious. Yes.
Right. And the one point that you brought up, that both of the individuals who called me, is that when they have the crisis, they go to, they don't have they go to the emergency room, so it's not the same physician. So the physician, some of them, I don't want to generalize, will not listen to the individual when they say what pain medication works best for them. And this is something that I've heard a number of times, and it's something that I would like to ask around in the community, you physicians, and get with you, Lois, on getting with the medical community and letting them know that a lot of the patients, when they're in crisis, they might go to one hospital one time, they might go to another time. So there's no continuity, and so there's a lag time when the patient will say, a medication works for them, the doctor will say, no, I'm going to give you this here, and it doesn't work, and it really causes a horrendous problem for a lot, and a lot of it is just a lack of information about this disorder primarily. And thank you, Dr. Pitts, for taking the time to explain that it is multi-organ affected. And so when all those organs are affected by this, and someone asked me, what was the difference? And I explained it this way to them. I said, if you have a tire, all of us have taken a tire, I know I have, and rolled it down the street, just rolling it. I said, it's pretty easy. They said, yeah. I said, now cut that tire in half and then try to roll it and see how difficult. And then they can understand how a red blood cell can get stuck, especially in the joints and in organs. And thank you so much for taking the time to explain just how serious and multifactorial this is. Okay, Lois, thank you so much, Lois, for allowing the time.
Yes, I appreciate it. It was very good. I also want to say, too, that a lot of times people think of this disease and they call it sickle cell anemia, but it's not the same kind of anemia that you get because you didn't take enough iron in your diet.
Exactly right.
So just taking, and so the anemia cannot be treated with just taking some iron tablets, the same as a person that is low in iron normally would be, because the red blood cells die quickly because they're not healthy red blood cells. So you have a turnover all the time. And we have to be careful with the iron too, because sickle cell patients a lot of times will get iron overload from the frequent transfusions that some of them require. So that's something I just wanted to clear up, because a lot of people know this disease as sickle cell anemia, but it's not the same anemia that is treated with taking iron tablets.
Exactly right.
So
thank you so much.
That's
and also,
right.
Just to add in that, we hear it kind of, some people use it interchangeably, sickle cell disease, sickle cell anemia, but just to be clear, with sickle cell disease, it's a group of blood disorders, okay?
Mm-hmm.
That's genetically inherited from your parents. Sickle cell anemia, that is, it's a specific form of sickle cell disease.
Right.
Right? So just to kind of keep it clear how, between
that's right.
And we appreciate, because it's understanding something. I mean, there's nothing like better than clarity. And so one thing that I like about this program, as you all know, just jump in that's a very important point for both of y'all to make. And I appreciate that.
Yes.
Okay, Lois.
All right. So now, how do we find out if a person has sickle cell, even from babies? Because this is an inherited disease, so therefore, whatever is present is going to be present from birth. So all babies are born in our nation, and we know in Georgia, have to be tested for sickle cell trait at birth. That is done. It's always been done for decades now, that all babies are tested when they're born for a sickle cell trait, or maybe the disease will show up then as well. It's diagnosed with a simple blood test that can be done, and that, as we said earlier, there are different types of sickle cell disorders or diseases. So sometimes it may show up as not anemia, it could be a different trait, because we have different variations or aberrations of the gene. And so sometimes it shows up in testing as a hemoglobin C or E, or different forms of that in the blood disorder group. We do newborn screening, as I said, and there's lab testing over time. Sometimes people lose their health records and they don't know what the results were when they were born, or whether they have this trait or disease or not. So lab testing, we recommend that it's done as you become an adult. A lot of times athletes have to be tested to play football and so forth in college, and it gets done at that time, because the coaches in the schools want to know if this young man has a sickle cell trait or disease, because of how that could affect their abilities. So, and the other group is the thalassemia. And you've heard of some patients having beta thalassemia. They could also have the alpha thalassemia trait. So all of those are different types of disorders in the sickle cell group, and it can be diagnosed through blood testing.
And also, Ms. Williams, just to add, when speaking of newborns,
Yeah.
babies usually will not show signs at birth of the sickle cell disease or the anemia, because when babies are born, we have, again, thinking about the hemoglobin, okay, again, the protein that carries oxygen throughout our blood. There are different types of hemoglobin. And with babies have a type of hemoglobin called what we call F hemoglobin, or let's say fetal hemoglobin. And fetal hemoglobin actually protects red blood cells in babies when they're really young, and it protects them from sickling. So again, remember, normal red blood cells, they're round, as you mentioned earlier, but with sickles, it's a crescent shape, okay? And so the fetal hemoglobin type protects the red blood cells in babies from sickling. And so at birth, the baby usually will not show signs. Up until, let's say, like around the 4th or 5th month, that's when the fetal hemoglobin is then replaced with the S hemoglobin, or the sickle hemoglobin, okay? And then from there on, at 5 or 6 months, then, it will usually show up as, this particular trait. So just to keep that in mind as well, that just because a baby, they can be healthy as newborns, but after a certain amount of time, when that particular hemoglobin is replaced, then you will see the hemoglobin S type, which leads to sickle cell.
That's right, and that's very important. Thank you for bringing that up.
And Dr. Pitts, that is very important. Thank you for bringing that. You want to know something? This is, I'm getting an adrenaline rush right now, because I just think about how many people are going to be viewing and actually learning and we're taking the time to explain every infinitesimal detail, because it is really important, because it pertains to everyone's health. And so thank you so much. And everyone just feel good jumping. I noticed Andrea, she's shaking her head because she's agreeing. She knows a lot of this stuff is important, and it really is. Okay, Lois, you can, and I see Susan over there, lady with the glasses, birthday lady. She's nodding her head too. So this is really good conversation. Okay, Lois.
All right, well, thank you so much. I think we've covered quite a bit of ground. There's still a lot more we could, but I know a limit of time.
No,
I
want you got it. No, do you want to know something? The one thing about this program, if it's important, guess what? We're going to do it. So please go on with the past diagnosis and all that stuff.
Thank you so much. All right, I wanted to stay in the same vein about the babies right now, to make the point that Dr. Pitts mentioned, that when after the fetal hemoglobin is no longer protective, and that child may have the SS or may have sickle cell disease, then one of the treatments that the doctors do is put the babies on a prophylactic penicillin for a period of time to help protect that child from getting the frequent infections that could cause them to go into crisis. So that's another way of treating the babies, because they can't always tell you how they feel to know how they're hurting, and also just to decrease the possibility of them developing these organ defects and having strokes. But it does happen sometimes. And we have had some babies that have had these strokes, and we call them, sometimes even adults, we call them silent strokes. So it's very important to have the babies' medical care kept up to date, and the family health care specialists keep them on a track of treatment so that they can keep up with how they're progressing. So what happens after we diagnose a person with the sickle cell disease, and we're educating the community, educating the medical community, and educating the sickle cell families? Then what we would like to have these people to do is they're moving forward to make sure they stay in touch with their local health departments to keep up with their care. Of course, we want them to contact us, the Association of Sickle Cell, because we consider them, as we say, their home here in Columbus, in this area, for keeping up with sickle cell disease, the latest things that's being done, and just to keep track that they are doing their routine medical care services just like anyone else would do, because they not only just have sickle cell, they're a person that needs to have healthy lifestyles anyway, to make sure that they are being treated properly. We ask that they try to be in touch with us, to sign up with us, to attend support group meetings that would give them information, and also to know their sickle cell community of other people with sickle cell disease, that they can share their ideas and the things that are going on with them. With our group, with our association, they can keep in touch with us, friends on Facebook, and we have on our social media outlets, they can be in touch with us on that. We keep them informed on what is going on in our community, and also to their medical doctors. If it's a family practice doctor, they should refer this patient to a hematologist, which most of them do, because the hematologist is the specialty in the medical world that takes care of sickle cell patients, because this is a blood disease, a blood disorder. So hematologists is what they need in addition to their regular family practice doctor. Now, we don't have any hematologists in Columbus at this time that specifically specialize in sickle cell care. We did have some, but now the hematologists are centered at the John B. Amos Cancer Center, and they're no longer taking sickle cell patients. So the Association of Sickle Cell, in conjunction with the National Sickle Cell Association, is providing a hematologist to come to Columbus once per month, and that is you sign up for that through our Association of Sickle Cell, and we will get you lined up and get them to see a doctor, a hematologist, here in Columbus once a month. And they keep their family practice doctor. If they don't have one, we can assign them a family practice doctor as well. Sometimes we have a family practice doctor there with them on the same day, but if not, then we have care at the Tree of Life that we associate with them. But we want, in other words, we want these patients to have good medical care to keep up with their care, because it's so important.
And Lois,
it's so important that they do that.
Lois,
go ahead.
What we're going to do, we're going to skip ahead, because we've covered a lot of good things. But it's very important for them to know that in addition to their regular physician, that they need to contact your organization to link up with a hematologist. And we've covered a lot of information, and we're going to have you come back. But I want you to talk about some of the fundraising events, because as I tell everybody in the community, New Horizons Behavioral Health, Tree of Life Healthcare, all the organizations that are out there in the community, but specifically these two organizations that I know for years, and not Johnny-come-latelys. I used to worry that I would have a paycheck when I worked for New Horizons, when Miss Winston was the CEO, because I was wondering, anytime that they put up on a wall, ask employees to donate money, I went home and said, baby, I don't know how long I'm gonna have this job. We got these two girls in school. They're asking their employees to help, only because they did not turn anyone away. And that really hit me, because you want to know something, Facebook family, my wife and I are blessed, super blessed. We're retired military. We don't have to pay anything for our health care. And even when we go to the doctor, my wife has had many illnesses. Recently, she's been ill. We would be out of our home and not have owned anything if we weren't. But it makes me as an individual more sensitive to the needs of individuals who don't have any. And to have organizations like New Horizons Behavioral Health, Tree of Life Healthcare, that see you, that have a heart like Christ, to give. Christ on the Mount told all of us, well, not just the ministers, was command for all of us to feed the hungry, visit those in prison, clothe the naked, to look out. That's all of us. And these two organizations have to do that. And I partner with them. But at the same time, I know that the community, in order for them to continue, they need to have help too. If you can donate, volunteer, who can't volunteer sometime? If it's an hour, half an hour, 5 minutes, 10 minutes, you can volunteer something. Here's another thing. Donations. No amount is too small. I tell people, 20 cents can make 40, 40 can make 60. Before you realize you got $1, $1 can make $2. No donation is too small for the organizations who are helping those who need help. And the doors are always open. And so would you talk about your fundraising events? I noticed if we can skip to that slide, because we're really way over time, and I know we started late, but this was such an important topic that I really wanted to cover everything. And so can you get to your fundraising plan? First of all, tell them how they can donate to you.
Right, that's right. Thank you for that, because we are very much in need, and COVID-19 has knocked us back this year, hit us quite hard. But you can go to our website and give us donations. We call it our GoFundMe donations right now. And on the web page right there, the donate button, and you could make a donation. SickleCellColumbus.webs.com.
Say that again.
And it's on the.
Say that again.
On the screen, isn't it on there?
There you go.
You see it? Social media.
No.
Facebook, and then the last one down there, Sickle Cell Columbus.
Lois, would you say it? We don't see it on the screen.
I will say it. Okay, it's www.sicklecellcolumbus.webs.org.
Okay. And you got fundraising events.
Fundraising projects. Also, we have raffles that will probably be done in June when we have World Sickle Cell Day. Each year, our major fundraisers are Heritage Breakfast in February and the Sickle Cell Walk in September. The breakfast won't be done this year, so the GoFundMe and the donations on the website is what's most important to us right now. As you said, 20 cents, 50 cents, $1, whatever you can give is very welcome, because it's very much needed. I would like to say that
something I've decided to do on this show is when there are events, organizations, New Horizons, a Tree of Life, before the program, if we have to start at 9:55, we will do that in order. I am in the future going to be, the hunger in this community is just off the chain. And I want people to know, not only here in Columbus, but in the counties. And it's been on my mind and on my heart to have a couple that delivers to 16 counties I need on their own, use their own gas and everything, load their own trucks, and they're over, I ain't gonna tell the age, but they are senior citizens. Hunger is a huge issue here. And you wanna know something? In this marvelous country of ours, marvelous country, no country like our country on the face of this earth, and the blessings that God has given us, we need to start thinking about people who are hungry. And so I'm going to start having a pre-program for 4 or 5 minutes, the status of hunger and places where people and organizations can go to donate food and whatever. I want to thank everyone. Andrea, would you let them know how they want to donate to New Horizons? Come on, you ought to have some money. Can't rely on those employees, Andrea only.
Yes, sir. And Susan may jump in with me. I believe that they can donate through our webpage, and that you can also contact New Horizons directly. The initiative that Pop was referencing earlier, we have an employee giving campaign, and our wonderful team members contribute a set amount or percentage of their paycheck to a fund that supplies things like unmet needs for individuals, such as prescription co-pays, doctor visits, assistance with utilities, preventing people from being evicted. So all sorts of things our team members contribute, but also we would welcome ways that the general public can contribute to us also.
And that's one of the things that helped me fall in love with New Horizons, because even though I told my wife, baby, start stocking up some groceries, and so we can have it in. I was so glad. I was so glad to see an organization that would do something like that, and I made sure my name was up there on that list on the wall.
That's
Not
right.
that I wanted anybody to see it, but it made me my heart feel good to know that I was doing like the Lord said. And
That's
Susan,
right.
what do you have to say?
Go ahead.
If you go to our website, www.nhbh.org, and click on the community tab, or if you look at the top of the web page, there's a donate button. You can click on there, and there's a donate button that'll allow you to make a donation directly from your Visa, MasterCard, American Express card. And we are grateful for any type of support that we receive, financial support we receive
And
from the
volunteers?
community. Volunteer information is on that community website also.
And Dr. Pitts?
Right. Well, Tree of Life, the same. You can donate directly. We do have a website. It is www, lowercase, one word, well, all words together, treeoflifehealthcare.org. So it's treeoflifehealthcare.org. Or you can always call our office again at 706-225-0355. And we welcome any donations, any type of volunteering. We definitely welcome it. But just one last point regarding sickle cell. Everyone can donate blood. Well, those who can donate blood, because there are some restrictions. But if you can, please do so.
Yes.
One of the critical care treatments for people with sickle cell disease is to have blood transfusions. And, you know, the science speaks for itself. There are studies that show that blood that come from people usually of the same race, they usually result in better health outcomes. And because it usually affects more people of African descent, and though in those communities, in the African American communities, sometimes the rate of giving, or at least donating blood, is usually lower than in other communities. So I would just stress that if you are able to, if you meet the health requirements, the weight requirements, all of that, to donate blood, usually through the American Red Cross. So please, that's definitely one way that we can all help.
And thank you so much for that. In fact, I was going to get with the executive producer, the lady with the glasses, and let her know that I had spoken to someone from the Red Cross to one of the programs that we'll be doing in April. And so, as I always say, I'm just so thankful that we're able to give information out to the community, because this is such a marvelous giving community once the people in this community know that there is a need. And so I'd like to thank all of y'all. And as I always want to say, I love you, my cousin Moya. She's the first thing, and she said again, Moya, I love you. Any last words from anybody?
Pops,
Okay.
I would like to add, I know we went over, so I didn't get to do this. So one of the ways that the public can know that feel good about the money they donate to us is that we have recently hired a community health coordinator. She's in the room there now with Dr. Pitts. Her name is Shalyn Chester, and she will be reaching out to the medical community. There she is. To the medical community and all of the medical organizations and the sickle cell patients to make sure that they're keeping up with their healthcare needs and to also help us to get the word out, awareness and education for everyone. Shalyn Chester, she's a new employee with us.
We welcome you. We didn't know that you were in there.
Yeah.
So glad.
Thank you. And we will be coming back with things and probably have you along with Lois Owen, Ms. Chester. Thank you for being a part of the team, caring for people. As I always say,
I'm sorry, Pops, the next clinic, Ms. Williams, I think it's going to be February 19th. So
February the 19th. That's right. The next clinic for the hematologist that we told you about earlier will be February the 19th.
Give the location.
And we'll get that information
again. Give the location again where Tree of Life is, so they know.
1968 North Avenue.
And what time does the clinic start? What are the hours?
The clinic is from 10 until 3 p.m. But it may not be at the clinic because sometimes we do a mobile unit. Last month
What
we
we'll
had
have
down at 4th Street.
What you do is send it to me or to Andrea or to Susan, and we'll make sure we put it on a Facebook show.
We're going to send it out to everyone.
Okay. As I always say to our Facebook viewers, we love just coming to you. It's been a prolonged show. I do know. I'm cognizant, try to stay cognizant of the time. I apologize that we started late, and I'm just glad that even though we are over for the information part, not for the tardiness, but for the information, because a lot of this information is crucial for individuals to know. And I want to also thank the Tree of Life. I'd like to thank Ms. Andrea Wentz. I know she's at meetings after meetings. She's probably missed one already. And Susan. And to all of my Facebook viewers, love you all. And as I always say, please be good and kind to yourself because God loves you. God bless you and goodbye. I think I did it right this time. I'm so proud of me.
Thank you for having us today, Bob.
Happy birthday, Susan. I didn't know today